Let's start with the death toll over there. The number of children and the child fatalities linked to Coldrif syrup has gone up to beyond 21. 24 is being reported at the moment. 21 deaths reported in Madhya Pradesh, 3 in Rajasthan. The victims, all under the age of 5, succumbed to acute kidney failure after consuming the syrup, which contained 48.6% diethylene glycol, nearly 500 times the safe limit. Also, what has happened in this case, the owner of Srisan Pharmaceuticals has been arrested. S. Ranganathan, the owner, has been picked up from his place. Also, he faces charges of criminal negligence and manslaughter in connection with the deaths. Number 3, what is the update here? The 26-page inspection report of the Tamil Nadu Drugs Controller Department revealed over 350 violations at Srisan Pharmaceuticals facility, and the violations included unhygienic conditions, use of non-pharma-grade chemicals, and lack of proper quality control measures as well. Number 4, what's happened here? Authorities have issued now warnings against other cough syrups. Now, these are the 2 names you need to remember: Respifresh and ReLife. From Gujarat-based companies, these products have been found to contain diethylene glycol, raising concerns about widespread contamination in the industry. And number 5, the scandal has also now sparked widespread public outrage with calls of stricter regulations and accountability in the pharmaceutical industry. And talking about accountability, let's bring on our guest. His name is T. Prashant Reddy. He's a lawyer and co-author of the book, The Truth Pill, The Myth of Drug Regulation in India. The book that he has written along with his co-author exposes deep flaws and gaps in India's drug regulatory system, revealing how weak oversight and has compromised public safety. It calls for urgent reforms to ensure stricter control and accountability in the pharmaceutical industry. So really, we couldn't think of a better person to actually speak to us, as 9 days have passed on this entire unfolding story on cough syrups. Mr. Reddy, thank you so much for being with us and taking out the time. I first want to start... Pleasure, sir. I want to start by understanding... You know, we're talking on day 9 since the first incident was reported here. We've seen, I just laid out the list of actions which have been taken so far. We are seeing some low-ranking officers arrested, suspended, 1 doctor arrested. We are looking at some companies being banned, some pharmaceutical, 1 in fact being picked up and arrested as well. We are also looking at a blame game of sorts between center and state on who's responsible. In your opinion, where does the buck stop in a case like this? Who is responsible for all these deaths that we've seen so far related to cough syrups?
Thank you for asking that question. That's a very pertinent question. And the facts in this case, in fact, highlight very well the convoluted structure of drug regulation in India. Because the tragedy has taken place in Madhya Pradesh, but the cough syrups were manufactured in Tamil Nadu. Now, the way Indian law is structured, the central government only sets standards for quality, and they take care of imports and the approval of new drugs, that is, validation of safety and efficacy of drugs. But the manufacturing license, which is the crucial component of quality control, is issued by individual state drug controllers, which means that the quality of drugs manufactured in India can vary widely across states. There are states who are better equipped laboratories, they have better resources generally because they're doing, they have better budgets. So those states may have better drug quality control, whereas a lot of states where India's drugs are actually manufactured, like Himachal Pradesh and Uttarakhand, have very weak drug control, local state drug control regulators. And this is the complexity, the heart of the problem in Indian drug regulation. You have one market for drugs, that is a drug manufactured in Himachal Pradesh can easily be sold across the country. But when it comes to regulation, you have this fragmented system of regulation where you have regulators, each state regulator and each union territory regulator looking at their own issues. So there are a lot of cracks in the system And a lot of stuff falls through because there isn't enough information sharing between different state drug controllers. For example, something as simple as having a centralized database. We don't have that. You want to check inspection reports, you want to check drug samples which have failed in government labs. There isn't a centralized laboratory. You can't find it.
Yeah. In your book that you wrote back in 22, you have argued that India's regulation on drugs is not just flawed, it's opaque, and it's also under-resourced. So are we to understand from this that this is not just a problem of implementation, but this is a problem of regulation as well? We need stricter laws and perhaps an overhauling of who is putting the guardrails when it gets to ensuring that bad medicines, contaminated, spurious, etc., are not entering the markets?
Yes, exactly. I mean, a lot of times after these tragedies, the focus is on issues like corruption and lack of, say, drug inspectors. But the argument that we were trying to make in that book, and which still stands true today, is that we have a problem with the way the system is designed. It is outdated. It was designed in 1940, where the concepts of quality control and regulation were very, very different from what we have today. And there have been attempts by the government to try and overhaul this law. For example, in 2017 or 18, I think when Mr. Jaitley was still a cabinet minister and alive, he was the one who had pushed for the government to enact a new law. Because what they were otherwise doing was they were putting band-aids on this old 1940s law. So in 2022, they did introduce a new bill, which was very badly drafted. There's basically a copy of the old bill. There was a lot of opposition to that. And after that, the government just dropped the ball. The need of the hour today is we need to overhaul the entire regulatory framework for drugs and to some extent nutraceuticals and design a new system, keeping in mind the federal structure of the country and the health needs of the Indian people.
You talk about the bill, but there was a revision, right? The Jan Vishwas bill that has been brought in by the government. What do you make of that?
Yeah, the Jan Vishwas bill was a very, very bad idea. It was it amended only one provision of the Drugs and Cosmetics Act. Basically, it decriminalized the manufacture of substandard drugs, which basically means if a drug fails to meet quality specifications regarding the active ingredient that it has, it fails to dissolve, or if it fails a sterility test, the law used to mandate imprisonment of 2 years and a fine of 20,000. So the Jan Vishwas bill basically said that we will make it a compoundable offense, for the first offense. That is, the first time you can get away by just paying a fine of 20,000 without having to face any criminal consequences in terms of imprisonment, which was a very bad idea. I mean, we need to be regulating the industry more, not less. But yeah, unfortunately, that law was passed by Parliament in 2023.
Right. I just want to get an understanding from you beyond just the present case of cough syrups. And we looked at some data, some of which has been pointed out in your book as well. 2020, in Jammu and Kashmir, I believe 11 children had died, again that time due to cough syrups. In 2022, we had the Gambia tragedy where 66 children had died. Uzbekistan also happened in 2022. In 2024, we dug up some data to find out that in the state of Karnataka, women who had just had cesarean operations were given some substandard IV drips that led to some deaths as well. Where I'm getting with all this data is the fact that in 2020, the company was in Himachal. In 22, the companies were in Noida and Haryana. In 24, it was a company called Paschim Banga. Now, in 2025, we're looking at companies based out of Tamil Nadu and other places. This is not just a particular state problem. We are looking at a systemic failure to keep a check on what enters the market. Is that correct?
Yes, that's very true. There's a systemic failure across the country. There needs to be a complete overhaul. And that overhaul is very, very difficult because the pharma industry at the state level is deeply enmeshed in state politics. You've got political parties, local politicians with stakes in pharma companies. They get funded by pharma industries, especially the small and medium sector, which is the most influential. So any attempt to try and reform this will require political parties to take this up at a national level. And we're unlikely to see that, unfortunately, because even after these tragedies are happening, if you notice, political party leaders are not speaking up because everyone's got skeletons in their closet, right? So it's not become a political issue this time. Even when it happened in Gambia, the government just washed its hands off the entire tragedy. And now we are facing the consequences after ignoring the export markets.
But why do you say that you don't see it getting any better? You wrote your book back in 22. Since then, there are a number of instances that have happened. This one surely doesn't make a case for any kind of betterment. But have you sensed any kind of reforms that have taken place?
There's absolutely nothing. Like they made it worse, right? With the Jan Vishwas Act, they made it worse. And beyond that, we are just not seeing any reform. So we keep reading in the newspaper where the national drug regulator, the CDSCO, keeps claiming that, oh, we went and did joint inspections with state regulators. We have shut down so many plants, etc., etc. But we can't find the name of one single plant mentioned in the newspaper. Similarly, with cough syrups, after the tragedies in Gambia, Uzbekistan, the Ministry of Commerce, under whom drug regulation does not fall, they invoked a trade law to set up a testing requirement for export, mandatory testing requirement. That so all the export consignments were being tested in government labs, and it was the press reported that about 100 samples had failed testing in those government labs, cough syrups. So we knew that there was a problem. They did not release the name of a single cough syrup into the general public, despite the fact that those same manufacturers who export also very likely sell domestically in India. So this was just a matter of time. The writing was on the wall. We were just not surprised. Dinesh and me, we were just not surprised when this happened.
So help me understand this. What will it take to ensure that this is the last of the deaths that we are seeing because of contamination of drugs or spurious drugs, etc., coming into the market? What do you think? What's the solution here?
It will take an act of God, honestly, given the way politics is running in this country right now. But if the optimist in me were to talk, I would say like a very low-hanging fruit, something that even the courts can do if they're interested, is to order the state and national regulators to make available all test reports, all inspection reports that they have done. So for example, that if we knew how many times this particular facility was inspected in the past and who did the inspections, we would then know how to fix accountability. And the moment drug inspectors know that their inspection reports are going to be made public with their name on it, they will start taking their job more seriously, because they know when a tragedy like this happens, it is going to be their head on the line. So greater transparency, as you know, that saying goes, transparency is sunlight is the best disinfectant. The only way I see things changing radically is if we infuse a large dose of transparency. And that is, again, very, very difficult in today's India.
All right, but that's a good suggestion, and we hope that people are taking due notice of this. I also want to understand this from you. Mr. Reddy, India prides itself in being an affordable market when it comes to drugs compared to a lot of countries out there. We pride ourselves in having more penetration of medical care, etc. But this story like this, when cough syrup deaths, IV deaths, etc. happen, we go back and question if brands are what we are to go for. In this fight between branded drugs versus generics, where do you really stand?
I think most of them are bad. I mean, You actually can't tell, because a lot of these so-called branded guys, like the big, really big top 10 big guys in India in the pharma industry, a lot of them engage contract manufacturers. So if you look at the fine print on the packaging, it may have the label of the big brand, but the manufacturing facility is actually somebody else's because these guys use their own facilities mainly for the export market. For the Indian market, they depend on contract manufacturers. So the fact that something is coming from a branded facility is no guarantee in India because if you read US FDA inspection reports of the biggest brand facilities in India, that's a different horror story on sanitation standards and data fabrication, et cetera, et cetera. So there really isn't any guarantee. And you ask doctors, even they don't know. I mean, everybody is cruising on prayers and luck. There's no concrete way to pin down quality in India right now.
Mr. Reddy, you paint a very, very sorry picture. Is there some hope? Is there something that you want to leave us with in terms of what we as citizens can do, what we can ask our policymakers to do? One change, perhaps, that we can bring. We've been bringing a checklist of sorts to tell people, read the ingredients, look out for this ingredient. But even if it's the right ingredient, you don't know if it's the quality, how substandard, etc. it is. Is there anything that you want to leave us with on a positive note? Because this is it's a serious, serious problem.
Yeah, I mean, see, it depends, like some certain kinds of medications which are more sensitive to quality issues. I would say trust your doctor. I know like Indians are very cynical about their doctors today, but for a lot of like, for example, nervous conditions, neurological conditions, thyroid and all, where the medicine is very sensitive, trust your doctor's judgment because doctors are constantly prescribing drugs and they get feedback from their patients. So even if it's a little bit more expensive, it's okay. Trust your doctor on that count. For stuff like cough syrup and all, just try and avoid it because even doctors say that a lot of doctors disagree with the fact that cough syrups are even required. Yeah. Beyond that, there really isn't much for me to add unless you want to, petition the health minister and ask him to do something about changing drug regulation laws in India. That's as far as I can recommend.
All right, Mr. Reddy, if the health minister was listening to you right now, what would be your one piece of advice to him?
I would say make everything transparent. Make inspection reports transparent. The government does a lot of testing. Make those test reports public from state labs and government labs. Government does a lot of procurement itself. And it does testing on those procurements. Those reports should be available because this is not a problem limited to smaller manufacturers and small cities. Last week, AIIMS, the All India Institute of Medical Sciences in Delhi, where a lot of VIPs get treated, they put out a press release saying that intravenous fluids that they had procured, they detected contaminated fungus in them. It's reported in the news. And they then banned the manufacturer. Now, when something like that, something as serious as this is detected in a manufacturing facility in a premier government hospital, alarm bells should have rung across the world, across the country, to withdraw other stocks manufactured by this company. That never happened. So these questions need to be asked of the government. Why are they not withdrawing these stocks when they detect that there's something contaminated? So there's no silver bullet. We need a complete system overall.
There is no pill to sort out this problem, really. One has to start by just making it more transparent, bringing it accountability, and I think that's what you're referring to. Mr. Reddy, thank you so much for joining us and giving us your insight into the story that is really horrifying. It has shaken up each and every one of us, and we can only hope that a logical conclusion is brought on and it just doesn't end by being a health story of the day. All right, but there are more updates when it comes to cough syrups. Now, the number of children's death in Madhya Pradesh due to the killer Coldrif cough syrup has gone up to 21. And this is not just an India story anymore. The World Health Organization has also woken up to the story. Here on 5 Live, remember, we've been tracking the story and the ongoing investigation into the deaths. And while we were at it, 1st of October, the WHO actually contacted the central drug body, the CDSCO here in India. WHO asked for clarification regarding potential links to contaminated medicines and whether the products were exported to other countries. It also vowed support to national authorities in investigating and responding to these tragic events. Now, since then, the WHO says it has been closely monitoring the situation and also the media reports regarding deaths due to cough syrups in India. So what happened after that? Now, the CDSCO was actually to give a reply to WHO, and that reply has been made public by WHO. What does it say? It says that the primary contaminating chemical in this case was diethylene glycol, or DEG, which has been detected in at least 3 oral syrup medicines. These medicines were amongst those consumed really by children in the reported cluster of cases. But what were they, and was it only Coldrif or more? Let's give you the names now of all the 3. Let me request my producers to pop that graphic also up on the screen. There you go. 3 cough syrups which have now been named in that reply to WHO. Number 1 is Coldrif, of course, made by Shrisan Pharma in Tamil Nadu with 48.6% diethylene glycol. Number 2 over there is Respifresh TR, made by Rednex Pharma in Gujarat with 1.342% diethylene glycol. And then it is ReLife, made by Shape Pharma Private Limited, again in Gujarat, with 0.616% diethylene glycol. The highest level of contamination, of course, over 48% has been found in the same cough syrup, which has been in the eye of the storm, which is Coldrif. Now, CDSCO has also now informed WHO that these products, these 3 that we named for you, have been recalled, and the identified manufacturer has been ordered to stop production of all medical products as well. The CDSCO has also stated that none of the products were exported from India, which was a question by the WHO. But the WHO has not received any official confirmation or any information as to the source of the DEG contamination. Most importantly, the WHO has emphasized on the regulatory gap in screening for domestically marketed medicines in India, which we have been flagging out throughout, and you heard Mr. Reddy there with his opinion on that as well. Let's take the story to the ground and let's understand how it's unfolding over there. My colleague Sharat Kumar from Jaipur joins us next. He's been doing some excellent reporting on trying to understand where really the responsibility lies. Sharat, आपकी रिपोर्ट तो हम इतने दिनों से दिखा ही रहे हैं. आपने कल जो रिपोर्ट करी, जिससे समझ में आया कि ये स्टोरी तो कफ सिरप्स की अकेले नहीं है. इसमें एंटीबायोटिक्स, इसमें एंटासिड्स, इसमें बहुत सारी और मेडिसिन्स हैं जिनके वायलेशंस पाए गए. वो वायलेशंस का रिकॉर्ड आपके हाथ में लग गया, पर सरकार ने या CDSCO के रेगुलेटर कह लें, उन्होंने इस पर कुछ काम नहीं किया. अभी क्या स्टेटस है उस रिपोर्ट का जो आपने निकाली थी 200 मेडिसिन्स की?
सोनल, मैं सुन रहा था आपको, आप प्रशांत रेड्डी से बात कर रहे थे, तो आप कह रहे थे कि ग्लूमी पिक्चर वो पेंट कर रहे हैं. दरअसल ये सच्चाई है. जो रिपोर्ट मैंने निकाली है, जो रिपोर्ट दिखाई गई है, उसमें बहुत सारी ब्रांडेड कंपनियां हैं. अब मैं यही सोचकर चौंक रहा था कि इतने अच्छे ब्रांड हैं ये, इनमें साल्ट नहीं है. अब इन ब्रांडेड दवाइयां हम खरीद कर लाते हैं सोचकर कि इतनी बड़ी फार्मा कंपनियां हैं, ये तो सही होंगी और उसकी दवा हम खा रहे हैं. ये कैसे हो रहा है? मगर ये एक सच्चाई है. जो 290 दवाओं की लिस्ट लेकर मैं बैठा था, जो कि राजस्थान के ड्रग विभाग ने जांच करके पाया है कि वो गंभीर रूप से अमानक थे, स्पूरियस केस श्रेणी में थे. उनमें से कई बड़े ब्रांड की दवाइयां थी. इसीलिए कहा जा रहा है कि ये देश में एक बड़ा खतरा है, जिस पर आप चर्चा कर रही थी. हाँ, लेकिन जब ये रिपोर्ट दिखाई गई है, उसके बाद से आज भी कई जगह छापे स्टॉकिस्ट के यहाँ पड़े हैं, और आज भी कहा जा रहा है कम से कम 7 से 8 दवाइयों को बैन किया गया है. वो भी ठीक ठाक कंपनियां हैं, कोई बहुत ब्रांडेड भी नहीं है तो कोई बहुत बुरी भी नहीं है. तो इन कंपनियों को भी रोका गया है. अब ये कहा जा रहा है कि ड्रग इंस्पेक्टरों को दूसरे राज्यों में भेजा जा रहा है, जहां पर वो बेंगलोर में भेजा जा रहा है, इंदौर भेजा जा रहा है, मंडी भेजा जा रहा है, जहां से वो कॉन्स्टिट्यूशन लेकर आएंगे कि उस राज्य में क्या कानून है, क्योंकि उस राज्य के कानून के तहत ही इन पर मुकदमा दर्ज किया जाएगा कोर्ट में। और ये सभी 290 केस में सरकार ने आदेश दिए हैं कि 1 साल के अंदर जितने भी ये ब्रांडेड नॉन ब्रांडेड कंपनियां हैं सब पर कोर्ट में केस दर्ज किया जाए। और जो अधिकारी थे उन अधिकारियों को भी कहा गया है कि सस्पेंशन कोई सजा नहीं है, इन पर भी कानूनी कार्रवाई की जाए कि आखिर 1 साल से जब जांच कर रहे थे हमारे ड्रग इंस्पेक्टर तो ये बैठे क्यों थे। और एक जो आज शुरुआत की गई है, 65 यूनिट हैं, दवा कंपनियां हैं राजस्थान में, वो सभी 65 दवा कंपनियों में जांच की शुरुआत की गई है जहां पर ड्रग इंस्पेक्टर जाएंगे। देखिए नियम क्या होता है कि कोई भी बैच अगर कोई कंपनी बनाती है दवा कंपनी तो ड्रग इंस्पेक्टर उसकी जांच करता है। मगर इस देश में ये इतना नेग्लेक्टेड डिपार्टमेंट है, इतना करप्ट डिपार्टमेंट है कि ड्रग इंस्पेक्टरों की संपत्ति के बारे में आप अगर सुनिएगा तो आप चौंक जाइएगा कि कितने पैसे वाले एक ड्रग इंस्पेक्टर होते हैं एक शहर में। आप समझिए क्या ये पूरा रैकेट चलता है, कैसा ही कॉकस बना हुआ है। जी
शरत, पूरी जानकारी के लिए बहुत बहुत शुक्रिया। इतनी शानदार रिपोर्टिंग करने के लिए भी बहुत बहुत शुक्रिया। ऐसे ही हमें बताते रहें कि क्या चल रहा है। मीनवाइल देयर इज मोर अपडेट कमिंग ऑन दिस स्टोरी, लेट्स ब्रिंग यू दैट नाउ। A news that we are getting in is that the Madhya Pradesh Chief Minister has accused Tamil Nadu government of non-cooperation in the probe. The Madhya Pradesh Chief Minister has alleged that Tamil Nadu government is not extending the required support in the ongoing investigation in the deaths due to cough syrups. So like we were saying, the blame game over there has only begun between states. And like we've also been pointing out, there also seems to be a regulatory framework lapse over here. Listen in to the latest.
तमिलनाडु में निर्मित दवाई के द्वारा जिस प्रकार से हमारे मध्य प्रदेश के अंदर हमारे बच्चों के खास करके कफ सिरप के मामले में ट्रीटमेंट के दरमियान उनकी किडनी खराब होने की घटना आई है, जिसमें लगभग हमारे बच्चों की डेथ भी हुई और जो बीमार और घायल उनको देखने भी आए। ये बात सही है कि जहां दवाई बनी है हमारी पुलिस ने आज वहां जाके दबोचा भी, लेकिन तमिलनाडु सरकार के द्वारा जिस प्रकार से पूरी सहयोग करना चाहिए उसमें वो सहयोग नहीं कर रहे हैं। वहां के ड्रग कंट्रोलर जो एक्सेस वहां उनका अमानक प्रकार की दवाई प्राप्त हुई, उस दवाई पे उसकी प्रॉपर तरीके से जांच होकर उसकी रिपोर्ट आ जाए।
And more updates coming in on that story. It's become Madhya Pradesh versus Tamil Nadu over the cough syrup deaths. Remember, one place in which the deaths happened, the other place where the company is actually from. Tamil Nadu Health Minister state government has informed about cough syrups for toxicity to MP and the central government as well, but perhaps insinuating that no action was taken. Listen in to what they have to say.
சார், இந்த கோல்ட்ரிஃப் காஃப் சிரப்பில் வந்து தமிழக அரசு சரியாக செயல்படலை, அதனால தான் ஒரு பிரச்சனைன்னு சொல்லி மத்திய அரசில் சொல்கிறதா ஒரு தகவல் வந்திருக்கு.
அதாவது இது சம்பந்தமாக 2-3 முறை பத்திரிகையாளர்கள் சந்திப்பை நடத்தியிருக்கிறோம். ஒரு முறை நடத்துகிற சந்திப்பிலேயே இது பற்றி முழுமையாகவும் சொல்லுகிறோம். தினந்தோறும் அதையே சொல்லி இது ஒரு மாநில உறவுகள் மத்திய மாநில அரசுகளுக்கு இருக்கிற பிரச்சனைகளுக்கு ஒரு பெரிய அளவில் நம்ம பங்கத்தை ஏற்படுத்தக்கூடாது.
சார், சரியான முறையில் ரெகுலர் டெஸ்டிங்ஸ் பண்ணலை அப்படின்னு சொல்லி சென்ட்ரல் கவர்மெண்ட் சொல்கிறாங்க.
சரியான விளக்கத்தை காலையிலேயே சொல்லியிருக்கிறோம். ஒரு நாளைக்கு 10 பிரஸ் மீட்லாம் பண்ண முடியாது, காலையிலேயே சொல்லியிருக்கிறோம். இருந்தாலும் இது கடைசியாக வச்சுங்க. இது ஏன்னா உங்களுக்கு வந்து டிவியில் அப்பப்போ அது என்னது பிரேக்கிங் நியூஸ் தருணங்கிறதுக்காக எங்களை பயன்படுத்தாதீங்க. கண்டாமினேஷனுடைய அந்த கலப்பு இருப்பது என்பது கண்டுபிடிக்கப்பட்டு உடனடியாக அந்த மருந்து பயன்படுத்தக்கூடாது என்று தடை விதிக்கப்பட்டது. ஃபர்ஸ்ட் மத்திய பிரதேசத்துக்கு இந்த மாதிரியான ஒரு கண்டாமினேஷன் இருக்குங்கிற தகவலை அவங்களுக்கு தகவல் அனுப்பியாச்சு. ஒன்றிய அரசுக்கு அனுப்பியாச்சு. ஒன்றிய அரசும் மத்திய பிரதேச அரசு மாநிலமும் 2 பேரும் அவங்க ஆய்வு பண்ணிட்டு இந்த மருந்துல தப்பு இல்லை, இந்த மருந்து சரியானதுதான் சொல்லி அவங்க இந்த இறப்புகளுக்கு பிறகும் அவங்க அறிவிக்கிறாங்க. நம்ம தப்புன்னு சொல்றோம், இங்க மருந்து விற்கக்கூடாதுன்னு தடை விதிக்கிறோம். அதுக்கப்புறம் இது சரின்ற மாதிரி அவங்க அறிவிக்கிறாங்க. மருந்து இருக்கு, கலப்பு இருக்கு அப்படிங்கிறத இங்க சொல்றோம். அவங்க ஒன்றிய அரசும் மத்திய அரசும் இல்லை அப்படின்னு சொல்றாங்க. அதுக்கப்புறம் அது பாதிப்பு ஏற்பட்டதுக்கு அப்புறமும் இல்லைன்னு சொன்னாங்க. இப்போ அவங்களுக்கு அங்கே பொலிட்டிக்கல் நெருக்கடி அதிகமான உடனே அவங்க இந்த மாதிரி ஒரு அறிக்கை விடுறாங்க. அது இன்னமும் கூடுதல் நடவடிக்கையாக அந்த கடந்த 2 ஆண்டுகளாக சீனியர் ட்ரக் இன்ஸ்பெக்டர் போய் முறையாக ஆய்வு பண்ணல அப்படிங்கிறதுக்காக 2 பேரை இப்போ சஸ்பெண்ட் பண்ணியிருக்கோம். இந்த மாதிரி தமிழ்நாடு அரசு ஒரு தவறுன்னு தெரிஞ்சதுக்கு அப்புறம் அவங்களை உடனடியாக நடவடிக்கை எடுத்ததெல்லாம் பண்ணியிருக்கிறோம். தவறுன்னு நம்ம சொன்னதுக்கு அப்புறமா அதை நியாயப்படுத்தி அப்போ பேசிட்டு இப்போ தமிழ்நாடு அரசு சரியான நடவடிக்கை எடுக்கலன்னு யார் சொன்னாலும் அதை யாரும் ஏற்றுக்க மாட்டாங்க.
All right, my colleague Pramod now joins us live for more on this. Pramod, it's quite sad to see this sort of political bickering happening over death of kids for no fault of theirs. At the moment, what is the status of the inquiry?
Sonal, one thing is very clear: the Ranganathan, the person, has been brought into the state of to Chennai, and he, for a transit warrant. They are waiting at the court as we speak. But the health minister, when we put forward these questions about how did the Tamil Nadu respond, because there are allegations that the Tamil Nadu government was pretty slow, and as this factory was in the state of Tamil Nadu, the state also bears a very important role in actually taking care of such a situation. He claims that he doesn't want to be a part of the breaking news, and he says that action was taken. He claims that he does not want to play the blame game, but however, he says that even after Tamil Nadu government has claimed very sure through testing that there was toxic substance and this is not a good medicine, Madhya Pradesh government and the union government did not take it seriously. That's how they are just having a blame game over it. And now Tamil Nadu government has suspended 2 drug authorities who are supposed to actually regularly go there and conduct inspections. But very clearly, a lot of questions are supposed to be answered in this manner because, just like you mentioned, innocent children are involved, and unfortunately, many have died because of this cough syrup.
All right, Pramod, we'll leave it there for the moment. Thanks so much for bringing us up to speed with that update. And staying with the news, India today has accessed now a key document that points to another serious lapse, a violation of safety warnings issued by India's top drug regulator. My colleague Milan Sharma brings us this exclusive report.
As the blame game intensifies between the sentenced states over the deaths of children after consuming cough syrup, a deeper and disturbing layer is emerging. India today has exclusively accessed a 2023 order by the Central Drugs Standard Control Organization that had flagged a specific fixed dose combination. Chlorpheniramine maleate 2 mg and phenylephrine HCl 5 mg as not for use for children below 4 years of age in 2023. This is the same combination used in Coldrif, a cough syrup made by Chennai-based Shrisan Pharmaceuticals Limited.
Despite the Central Drug Control Authority's strict warning to drug manufacturers to put the label behind the cough syrup Coldrif of not to be used for children below 4 years of age, the company did not comply. This is what actually led to many doctors prescribing this anti-cold syrup in the first place to children that has resulted in their death.
In fact, one of the questions now being raised is why this drug was prescribed to children under 5 years of age when national protocols clearly warn against it. Multiple deaths of children have been reported in Madhya Pradesh and Rajasthan after consuming cough syrups with the same FDC. Now other manufacturers using the same combination and who failed to comply with CDSCO's labeling order are under the scanner.
With questions now mounting over regulatory oversight and medical protocols, the accountability not just lies with the state drug regulatory authority, but also squarely with the drug manufacturers and even the prescribing doctors. Ultimately, the question is, what killed these children?
With questions now mounting over regulatory oversight and medical protocols, accountability lies not just with the state regulators, but also with non-compliant drug makers and prescribing doctors. With Milan Sharma, Bureau Report, India Today.
And Milan joins us live now for more context on this story. Milan, this whole concept of FDCs, fixed drug combinations, you're saying there are two that have clearly been pointed out by the drug controller but was not enforced in the market. At the moment, what is the status? Are these FDCs still freely available?
Well, yes, these fixed dose combinations, the one that we're talking about was flagged by the DGCI in 2023. And what the manufacturers were supposed to do was put them on the label at the back of the cough syrup and write clearly that this is not to be used for children under 4 years of age. Many other drug makers have also not complied with this particular order that was issued by the Central Drug Controller. And therefore, now CDSCO has launched a nationwide crackdown on all the drug makers, especially the cough syrup makers. They have asked every state to provide them a list of cough syrup makers, and they will be looking at inspections, which will be joint and singular inspections throughout the country to weed out this kind of non-compliance that is happening from all the cough syrup makers. So it's a nationwide crackdown that's going to happen now in the light of what has happened in Madhya Pradesh as well as in Rajasthan as well. And the entire issue of writing these warnings on the packaging labels is also going to be part of it, because the CDSCO clearly, sources have told us, that was not aware of Session Pharmaceuticals operating in Tamil Nadu in the way that it was, because the TNFDA had not informed the center, because they are well within their jurisdiction to do, singular inspections as well. But joint inspections should be done when licenses are being given, and it's mandatory after 2017. So it's going to be a nationwide crackdown on all syrup makers now.
Good that nationwide crackdown is happening. Too sad that it has taken deaths of over 24 kids now to actually make that happen. But let's see where this goes. Thanks so much, Milan, for joining us with the very latest. We've got more ground reports for you and more shocking revelations that have emerged from this time, an inspection that was ordered by the Drug Controller General of India. The inspection team in Indore found massive irregulations at a company. The company is called ARC, from unhygienic conditions in syrup manufacturing to the alleged use of contaminated water and improper storage in even plastic containers. Authorities have now sealed the premises and also halted all production. After the deaths of several children in Chhindwara, the Indore District Administration has also launched a major crackdown on local medical stores, seizing more than 50 samples for testing. And officials say any firm or chemist found violating the drug safety